Hi, Stephanie here with Mahalo.com, and we're talking about infertility. Of course, it is an emotional struggle for couples who are going through it. One of the options is in vitro fertilization, and joining us now is Dr. Jain to talk a little bit more about how to use in vitro fertilization. What are the steps?
Sure. Well, first of all, let me define in vitro fertilization. It actually means fertilizing an egg outside the body in the lab. Today we use it to describe a series of processes that culminate in the production of a human embryo for embryo transfer. Women or couples who need in vitro fertilization include those who failed simpler forms of therapy, men with really low sperm count, or women with blocked tubes. The steps are as follows. Women administer hormonal injections to themselves for about 2 weeks. This is followed by a trip to the operating room, during which the eggs are retrieved using a suction needle. The eggs are then transferred to the IVF laboratory, where they're fertilized and allowed to grow as embryos for about 3 to 5 days. The final step is the transfer of embryos to the uterus of the intended mother. And so that's the whole process. And with that, we see great success rates.
Yeah, let's talk about the success rates. What are the percentages right now?
Well, they're quite good for women under 35. For example, if we're using IVF for infertile women under 35, birth rates of 40 to 50% can be expected. For those 35 to 40, it's down to about 35 to 40%. And for those over 40 and under 44, it's about 20%.
So those are still very strong percentages when you consider what our normal percentages are of just getting pregnant.
Absolutely. Now, of course, the more embryos we transfer, the more chances they have of getting pregnant. But we always try to limit the incidence of twins or triplets. These are high-risk pregnancies, and it's always been a challenge in our field to help get a patient pregnant, especially someone who's spent a lot of money and has a lot emotionally invested in the process. And so while we want to transfer less embryos, patients frequently ask me to transfer more embryos, and that becomes sometimes a difficult decision.
Yeah, let's talk about that. I mean, is there a baseline? Do you recommend typically, transferring a certain number? Because some of them won't take, right?
Absolutely. So the whole idea of in vitro fertilization is really playing the odds. More high-quality embryos means more chance for pregnancy. We have national guidelines on this that have been developed by the American Society of Reproductive Medicine. For example, women under 35 should only have 1, maybe 2 embryos transferred. For women between 35 and 40, 2, maybe 3 embryos transferred. And for those over 40, you can transfer 5 embryos. That's because we expect that, for example, in women over 40, most of those embryos will not make it.
And if you do have more embryos, you may have more births. We've seen Octomom, of course.
So there with the California octuplets, the so-called Octomom, we've seen the effect of IVF on multiples, which we're all trying to safeguard against.
So let's talk a little bit about those embryo transfers. Let's say you choose to transfer 5 and they all take, but the couple only wants 1 or 2 children. That seems like a tough situation. What happens there?
There's a procedure called selective reduction, which 1 or more of the pregnancies is terminated around 12 weeks. It's an emotionally difficult thing to go through, and we all really try to avoid it. That's why I think careful planning and counseling ahead of time and transferring less embryos is probably better.
All right, Dr. Jain, thank you so much for taking us through the steps of in vitro fertilization.
Sure.
And if you'd like more information about fertility, you can click on any of these links, or you can subscribe to Mahalo Parenting. Want to give a special thanks once again to Dr. Jain. I'm Stephanie Stanton. Thanks for watching.